Okay, in the medication room, I'm going to be verifying the doctor's orders against the MAR. Today, the doctor's orders are 4 units of regular insulin every morning before breakfast and Rosefin 500 milligrams every day IM. I'm going to assess in the medication room the medication history, medical history, any known allergies of which this patient has none, height and weight of the patient. This patient is 5'6", 150 pounds, the age of the patient, and pertinent lab results. Insulin is for monitoring maintaining blood glucose levels, and Rosefin is an antibiotic. So for their labs, I will be checking their last blood glucose level and their last white blood cell count. I'm going to now wash my hands and pull the medication. I'm going to check the integrity of the vial and its contents and the expiration date for each medication. For insulin, the integrity is intact and the expiration date is 4/21. And for Rosefin, the expiration date is 4/21 as well, and the integrity of the vial and its contents are intact. I'm going to be checking the vials against the medication, the MAR, and the doctor's orders to make sure that I pulled the right medication. And now I'm going to draw up the medication. First, I'm going to clean the area with an alcohol pad, and then I'm going to draw up my medications. First, I'm going to do insulin. I need 4 units of insulin, so I'm going to pull up 4 units of air first, making sure not to touch any sterile areas of the needle. Make sure I don't break the needle. 4 units of air injected into the vial, and then I flip it over. Being careful again for sterility, I pull 4 units out, and then I'm going to scoop cap my needle back together. And then for my IM injection, I'm going to be pulling up, I need 1 milliliter of Rosefin because my order is 500 milligrams and the available is 500 milligrams per milliliter. So I need 1 milliliter. I'm going to pull up 1 milliliter of air. And then I'm going to inject that air into the vial. Flip it over, carefully draw the medication, carefully not to break sterility. 1 milliliter. And then I'm going to safely recap that using this scoopity scoop. Then I'm going to actually be removing this, throwing that in the sharps container, and get a new head of the needle, being careful not to touch any sterile areas. And that is ready to go. Now I'm going to be gathering all of my necessary equipment to bring with me to the medication room. But before I do that, I'm going to make sure that I drew up the correct medication. I'm going to check the MAR for the second time officially. I'm going to make sure, check my syringes, that I have the right amount of medication, check my vials, and check the MAR, make sure I draw up everything correctly. Now I'm going to gather up all my necessary equipment, my syringes and needles, my vial. I got some gloves, alcohol prep pads, and my MAR and doctor's orders. Now I go to the patient's room, I knock on the door, introduce myself, state why I'm there. I'm Erika, I'll be taking care of you today. I'll be giving you your insulin and Rosefin injections. I'm going to now wash my hands in the patient's room. I'm going to check the client using 2 identifiers, and I'm going to check their wristband. Now at their bedside, I'm going to do my third MAR check. I'm going to be checking my MAR, my syringes, and my vials again to make sure I drew up everything properly at the right dosages. Now I'm going to be asking the patient a couple questions about their plate, where they are, the time of day, to make sure that they are alert and oriented. I'm going to ask about any allergies. This patient, again, it tells me they have no known allergies. Their knowledge of medications, the knowledge of the medications they're going to be given, last time they were taken, and the last place they were injected, if they've had these before, and if necessary, explain any questions and answer any questions that they may have. I'm asking these questions to be able to assess their level of consciousness and ability to cooperate. I'm also going to delegate assistance if necessary at this time, if I'm going to need assistance positioning the patient. And now I'm going to apply clean gloves. Okay, so my first injection I'm going to discuss is going to be, here's my patient. My first injection is going to be an IM injection. I can do IM injection in a couple places, the ventrogluteal, vastus lateralis, or the deltoid. Today, I'm going to be using the ventrogluteal because a patient told me that the last injection was in the deltoid. In the ventrogluteal area, to find my anatomical landmarks, I'm going to place my palm of my hand on the greater trochanter, my thumb towards the groin, my index finger towards the anterior superior iliac spine, and my middle finger towards the iliac crest. In this V between my index finger and middle finger is where I'm going to be injecting the medication. For the vastus lateralis, which is another location, I would put 4 fingers below the greater trochanter, 4 fingers above the patella, and I would inject in the middle third of the leg on the lateral aspect in the vastus lateralis muscle. So at this time, like I said, I'm going to inject in the ventrogluteal area. So I have my ventrogluteal area in front of me. I have assessed the landmark. I found my landmark, and I'm going to inspect the area and palpate for bruises and any lumps or anything. I've also assisted the patient into a comfortable position and asked them to relax the area. So I will be asking them to relax their leg. I will clean this area with an antiseptic wipe and allow that to air dry. I'm going to loosen my needle. And then I'm going to, with my non-dominant hand, being careful not to touch where I cleaned with the alcohol wipe, I'm going to pull the skin taut. And then I'm going to, at a 90-degree angle, inject my medication, stabilizing with my other hand while I inject the medication and keep the skin taut. And then I'm going to pull out at the same angle I came in, throw this in the sharps container, and apply pressure with gauze, but do not rub the area, just pressure. I also will have made sure to have left the needle in there for 5 seconds for the medication with the skin still taut, to let the medication go throughout the muscle. Then I will be talking about my subcutaneous injection. So the SubQ is my insulin injection. I can give this either in the lateral aspect of the upper arm, or I can give this in the abdomen. I'm going to be in rotating site from last time. They told me they got it in the arm, so I'm going to be giving it in the abdomen this time. This patient is of average size, so I only need to pinch about an inch of skin in the abdomen. I need 2 inches from the umbilicus. So I'm 2 inches from the umbilicus on the right hand side. I'm going to inspect the area, palpate for bruises, and at this time I would assist the patient into a comfortable position and ask them to relax their abdomen. I'm going to clean this site with an alcohol wipe, allow it to air dry, and I'm going to loosen my cap. Okay. All right, now I'm going to be administering the medication. I'm going to, I'm going to pinch the skin, an inch of skin with my non-dominant hand, and I'm going to quickly inject at a 45-degree angle because this patient is average size. I'm going to I'm going to leave that skin taut or pinched, inject at a 45-degree angle, withdraw the needle at the same angle I came in, and throw this in the sharps container and apply gauze, applying pressure, but do not rub the area. And then now I'm going to do my evaluation portion after I've thrown that in the sharps container. I'm going to clean up the patient in the area. I'm going to remove my gloves. I'm going to wash my hands. I'm going to put the bed back down to its lowest level, side rails up ×2 at least. Place the call bell within reach of the patient. assess again at this time before I leave the room. I'm going to assess the area again for palpate the area for bruises, any pain. I'm going to ask the client if they have any pain, any discomfort, or if they need anything else that I can provide at that time. And then I'm going to document on my MAR and leave.